Question: a 65-year-old male presents with bone pain, skull enlargement, and hearing loss. Laboratory findings show elevated alkaline phosphatase, ALP, with normal calcium and phosphate levels. X-ray reveals thickened, deformed bones with a cotton wool appearance in the skull. What is the most likely diagnosis? A. Osteosarcoma. B. Paget's disease of bone. C. Multiple myeloma. D. Fibrous dysplasia. Correct answer: B. Paget's disease of bone. Paget's disease of bone, Oteiitis deformans, is a chronic bone disorder characterized by excessive bone turnover due to increased osteoclastic and osteoblastic activity. Key features of Paget's disease of bone: bone pain, deformities, and fractures. Increased skull size, hat no longer fits, hearing loss due to cranial nerve compression. Spine and weight-bearing bones commonly affected, bowed legs, kyphosis. Elevated alkaline phosphatase with normal calcium and phosphate. X-ray findings: thickened, disorganized trabecular bone, cotton wool appearance in the skull. High risk of osteosarcoma, rare but fatal. Family history, genetic predisposition, SQSTM1 gene mutation. Why not the other answers? Osteosarcoma, highly aggressive bone cancer, more common in children and adolescents. X-ray shows sunburst pattern and Codman's triangle. Paget's disease can lead to osteosarcoma, but Paget's itself is not a primary osteosarcoma. See multiple myeloma, lytic bone lesions, hypercalcemia, renal failure, and anemia. ALP is usually normal unless there are fractures. Bence-Jones proteins in urine. D. Fibrous dysplasia, presents with bone deformities and cafe au lait spots, McCune-Albright syndrome. X-ray shows ground glass appearance. Does not have ALP elevation like Paget's. Management of Paget's disease of bone. Bisphosphonates, alendronate, zoledronic acid, inhibits osteoclasts. Calcium and vitamin D supplementation. Surgery for fractures or deformities. Bonus clinical tip: Paget's disease of bone in an older adult with unexplained fractures and hearing loss should always be suspected. Would you like more bone pathology questions or metabolic disorder questions?